Hello, everybody. Sorry for the little delay. This is Dr. Elsie Coe with Lead Physician. I have a special guest today. Kristine Olsen is here today. Let me introduce you to her. Hi, Kristine. How are you doing?
Hi, Elsie. Great. Great to be
Thanks.
here with you.
Thanks for being here. We had a little glitch in the technology that happens. She's a chief wellness officer and she's a practicing hospitalist at Yale-New Haven Hospital. She's double board certified in internal medicine and pediatrics. She's a native to Minnesota and she's a former returned Peace Corps volunteer. So thank you for that, Kristine. Thank you so much for being here.
It's a pleasure to be here. Thanks for the invite.
Yeah, I want to really focus in on one of your articles that you put together. I found you're very prolific in what you write. I could see that you like to write. Is that correct?
I do like engaging in this space. Yeah.
So I'm going to show this article that you wrote to every. Tell us what are some of the what is a chief wellness officer's role ideally, and what do you do, and do we need more of them? So let's start with that, and then I want to go into these strategies that everyone can take away.
Sure. Thanks for highlighting that work that we did in collaboration with a number of chief wellness officers around the country. And we did that in response to our colleague, Miriam Stewart at CHOP, had the invitation to curate this whole journal. And we brought a bunch of chief wellness officers together to answer the question, well, what do we do? People would ask, well, what are we going to do, Kristine? So this was to address that and to go with our annual wellness surveys, and then to match what you can do with those surveys. So we're really glad to have had that opportunity. So what's a chief wellness officer and why do we have them? Who should have them? If you are an organization that has grown, wants to grow, wants to retain top talent, wants to create an environment where people thrive in their work and do their best, then you'd want a chief wellness officer. If you are interested to make sure that the population has access to high quality, high value, exceptional patient care by thriving healthcare workers and physicians, then you want a chief wellness officer. And a lot of what we do is do the assessment. We're kind of a bridge between stakeholders. So we connect a lot of the organizational stakeholders and bring people's voice and talent into the organization and the function, so that people feel like they're engaged, they're empowered, they belong, they believe. So people feel seen, heard, valued, and developed in the organization. And
are they always physicians, Kristine, or are they can they be other healthcare workers in background?
Yeah, they can be people who are trained and steeped in the science of thriving and well-being, and what you need to assess and how you need to act on that. I think physicians are a natural fit for this because of the role that they play in healthcare. They do have a lot of experience with leading teams and working with patients and moving patient care throughout the organization. So they're really at that pivotal point, that crossroads where you have to do troubleshooting. You have to be an advocate for your patient, move them through the system, and whether it's efficient or inefficient, you run into all of those things. So you have a lot of insights there, and you work with a lot of allied health professionals. So I do think that physicians are in an exceptionally good place because of their experience to be chief wellness officers. And I know a lot of people are looking to integrate their wellness programs. And so they're looking to have physicians lead those and bring everybody together as a team, all the allied health professionals.
So Kristine, I have so many questions for you, but this is a very short interview. But how do you become a chief wellness officer if you're interested in doing that?
So the way I became a chief wellness officer was before there were chief wellness officers. After healthcare reform, I went to fellowship in health services research and epidemiology on organizational structure and process, and looking at wellness as a proxy measure of health policy effects and organizational performance. So that allowed me to really study the structures of work-life well-being. But I think anybody can go about doing an assessment, doing a survey assessment of your organization, creating that burning platform, and then matching a plan with that. And the article that you showed is a plan forward. So you can match your assessment burning platform with that plan.
Okay. Isn't that a full it sounds like a full-time position, and yet you're a practicing hospitalist. So can you talk about a little bit about your timing? Like, are you spending 60/40, 50/50, 30/70?
Yeah, majority of my time is dedicated to this work. Ideally, I think how much time you spend on this work, I do think you need to have the bandwidth to be able to do the good work.
Mhm.
And I do think no matter how much time you're dedicated to doing this, you do need a support team. You need project managers and assistants and people to create the platform to engage and empower people.
Okay. So let's talk about this article. Strategies in helping with this crisis that we're in.
I'm sorry, I couldn't hear that first part of your question, but
Why organizational strategies versus individual? And then what are the top three organizational strategies we could take away from today?
yeah, organizational strategies because they've been proven to be most effective in addressing burnout and these work-life occupational hazards. Um, it's an occupational hazard because we know it's industry dependent compared to the general population. We know it's temporally related to entering clinical work. We know that it is dose related to your exposure to clinical work. We know that it's more responsive to organizational interventions. So that's part of why we call it occupational hazard and why we think that the organization is really the key to improving work-life well-being. And what are some of the strategies? If you look at the 3-domain model authored by Brian Bowman of Stanford with the culture and climate and practice efficiency and personal resiliency, what does that mean? You're looking at how do you improve um, leadership, value alignment, contingent on high stakes, complex decision makers and transformational servant leadership. Teamwork, what are the elements of teamwork as organizations grow larger? How do you keep them flexible? How do you really create teamwork as an organization grows? Collegiality, and that sense of both leadership and collegiality are a sense of feeling seen, heard, and valued, and then even developed. And then how you feel like you belong. Are you able to do the meaningful work? Are you able, diversity, equity, inclusion? Do you feel like it's a place where you feel really valued, seen, and heard? And then when you think about practice efficiency, you're thinking about the workload, you're thinking of the flow, the pace of your work. And that has, so that has a lot to do with just efficiency. And when people have challenges that are hindering challenges, the job demands resource theory and conservation of resources, people will withdraw themselves. That's the burnout, because you keep working against a frustrating type of challenge. You want to remove those challenges that feel like they're keeping you from accomplishing your mission of excellent patient care, and you want to engage people in challenges that invigorate them in the flow, and they're absorbed and they feel dedicated to those challenges. So you want to do that. And then when it comes to personal resiliency, we're really talking about a person's ability to job craft and have work-life balance, to be able to go home, rest, and recharge, and to do those things that really rejuvenate people so they come back the next day ready to go and ready to do those challenges that are invigorating and that they're dedicated to. So kind of think about that. And when you think about personal resiliency, you're also thinking of what kind of support do you have at work for the type of work you do. And we think about for physicians, sometimes there are adverse outcomes that it's nobody's fault. There could be fault. It happens. It's part of stepping up to be responsible for the care of people in their time of need. And then when it doesn't work as optimally as you hoped, everybody feels bad. And who's there to support those caregivers in times like that? So making sure that someone who really understands the work is there for them.
Kristine, you sounds like you have a lot on your plate there because that's a lot to do. I mean, the bottom line is you're saying open channels of communication among all different sectors of your organization and making sure your employees, especially the people in the front lines, are being heard. And I want to include, nurses and allied health professionals in this. But basically, you're saying, where's the feedback loop? Where's the feedback loop, and making sure that we're providing what those people in the front line need to function? Because if EMR is not working, or they constantly have to do double the amount of work for the same thing, then you're going to get burned out. But then you also said that you need personal resilience. So is that where leadership for physicians come in, training?
Yeah, I think every person can learn how to do leadership training, whether you're in a formal leadership role or an informal leadership role. All physicians are in some type of leadership role. I would say every individual is in some type of leadership role, even if informal, of how you are a role model and conduct yourself at work. So everyone can benefit from that. That training, if you look at servant or transformational style leadership, it's about knowing the intrinsic motivations of people, making people feel seen, heard, and valued, and helping to develop them in ways that are meaningful. And that's true for anyone.
Right, right. So what do you do if your senior leaders are not on board in this kind of communication style that's never been done before? It's old school. And yet we're seeing this problem of physicians burning out, leaving the workforce. Is this a wake-up call to these people? And are you the person to tell them, hey, wake up, and this is what we need to start doing?
I think burnout is first shown by Tate Shanafeld with the triennial surveys, showing that we have a burning platform. At that time, when he first did those studies, showing that burnout was more than half of physicians were feeling burned out. Now we're doing these studies with everyone, showing the stress and strain that people are under, especially with the pandemic. So I think yes, this is a critical time, because we looked at burnout before the pandemic, and now the pandemic has added additional stresses and strain. What a chief wellness officer can do is be one person at the table, because when the chief wellness officer is there, people remember to say, well, what's this going to do to wellness? So you should be thinking of what's this going to do to the patient experience, access, quality, safety, and the well-being of those who are showing up and caring for people every day. So I think that's
Yep. And
important.
not just that, not just the safety and the care and what's happening to society, what's happening to the organization, but it's also the cost to the system. What is the cost to the system for every physician that leaves the system?
Yeah, for physicians, it can be anywhere from $500 to $1.5 million. I think especially the paper that Tate first did on making the business case, Tate Shanafeld, was $1 million in turnover costs. And that was just turnover costs. That was the vacancy, the recruiting, the onboarding. It didn't include what it did to burnout for those left behind, picking up that stream of work. It didn't look at malpractice and things like that. So it's very costly, and people say even a fraction of that cost, if it's put toward the well-being of the caregivers, it pays dividends, high return on investment.
Yep, I love that. I thank you for. I mean, not I love that, but I mean, I love the fact that you put it out there so everyone could see. So, How do we get more chief wellness officers out there like you? Are there what programs are there to develop physician leaders into chief wellness officers?
So one good program, an excellent program, is that Stanford WellMD has on for chief wellness officers and directors of wellness. So we have a council of the Clinician Wellness Council led by wellness leaders from all of our departments and sections.
Okay.
So there's free training for that, but high demand, hard to get into those courses. And then there's chief wellness officer courses to give you an overview. That's one way.
Okay. Well, thank you so much for being here. I really appreciate what you're doing and helping healthcare workers, including physicians, in living better lives. I bet people want to work at Yale where you're at. So thank you so much. How can people reach out to you, Kristine, if they're interested?
Feel free to email me, kristine.olsen@yale.edu. I'd be happy to
Thank
help.
you.
Oh, it's just Olsen with the O-N, the O-L-S-O-N.
Oh, goodness gracious. Let's edit that right now. I could do that live.
Yeah.
So people can there it is. Olson. So if you want to email her, thank you so much for being here. I appreciate it. If you are interested in giving a topic to converse and give out to people here on social media, please reach out to me at info@drlcco.com. Also, we have our lead program starting, and I want you to reach out to me if you're interested, because you will get the benefit of having more one-on-ones if you reach out to me at www.leadphysician.org. Thank you so much for being here. You are a great leader, and I love meeting people like you. I learn so much from people like you. So let's talk again later, Kristine. I really appreciate it.
Likewise, Elsie. Thank you.